you let me give you a session per other peripheral facilities. I will
Yes.
not want to talk about Kolebu here.
Yes.
So other peripheral facilities, a session is I think the lowest we can get is about 550 to 600 cities, and the highest we can get is 700 to 800 cities.
So
So
a session
let's
costs about
let's
600
use
Ghana cedis.
okay. So let's use 600.
Yes.
600 times 3
1,008.
times 4.
That's a lot of money. Let me do the
That's a
calculation
lot. It's
quick.
about 5,600 cities, something
I'm
like that.
telling you.
And that is just dialysis.
No.
And I told you dialysis only functions, just does the excretory function and also the regulatory, like removal of fluids, removal of urea, but it doesn't do the hormonal function. So you need extra medications like erythropoietin that the kidney needs to produce. The dialysis cannot produce that. And that one, we have about 100 cities. So you need twice in a week. So like 200 cities per session. So you get about 400 cities in a week. Then the iron you get about 100 cities. So let's say 200. So that alone is about, let's say 400 cities. So 400 cities plus plus the 1,008 cities per week. So you end up spending about 2,200 cities or 2,300 cities per week just to get a for you to get good dialysis and to just act normally. I mean, to have a normal life. You understand? Times
Yes.
4, so 2,000 cities times 4, you end up having about, let's say 6,000, 5,000. And how much is our minimum wage, and how much are we do get in a month? So risk factor. Look out for these things that will cause the kidney damage, and we should help. We should make sure that we prevent that. Thank you.
Yes. Doc, thank you very much for putting it into financial perspective. Just to rehash what Doctor just said, a minimum of 1,008 per week adds up to 7,200 for just the dialysis. Then you're going to spend about 100 Ghana cedis on erythropoietin and about similar on other things. So totally you're spending about 8,000 minimum. That is if you get it at 600. But if you go to other facilities that do it for 700 and 800, you're going higher. And aside this, you're going to be on other medications as well. Now, putting it in dollar perspective for our foreigners, we're talking about you're spending about $700 per month, about $700 to $1,000 per month. So what doctor is championing, that's why he readily accepted to make time for us all these back-to-back 2 weeks, is that let's focus on mitigating the risk factors. Make sure we do things that does not expose us to having kidney injury or damage. And even if you have the kidney injury or damage, let's make sure we adhere to the doctor's prescriptions, the doctor's advice, so that it doesn't progress to kidney failure. That is the one he doesn't want us to get to. All right. Thank you very much, Doc.